medical student could be best summed up with work hard and play hard. In the day, you work hard, study hard, and in the afternoon, you decompress and do things that you enjoy. Medical students are part of a new curriculum which really emphasizes a lot of independent learning time and integration of course material. So our schedule actually varies slightly from day to day. Some days we have half a day of classes, other days we have a whole day of classes, and what classes we have each day can be slightly different. We might have labs or lectures. So for me to be able to keep the varying schedule straight, what I treat medical school kind of like is like a job. Kind of 9 to 5, this is the designated time I do my work. So when I'm not in class, I'll go study, make sure I get all my work done for the day, and then afterwards I leave time to do social things or do volunteer work or do extracurriculars. Well, one of the new components of the new curriculum is less in-class lecture time. So some of our classes we actually don't have lectures anymore, such as anatomy, so you can access those lectures from past years online if you want to watch them. And also in the lectures, since there's less lecture time, they really focus on the pertinent information that they want to get across. So our professors try to do more hands-on things. So we did an activity once using jelly beans to simulate different genetic conditions and topics. So it's cool to do something really hands-on. So the new curriculum is really nice because everything's integrated together, and they try to correlate the course material we're learning in one class with another. In one class we'll be provided with like the basic knowledge, basic fundamentals of a topic, and the other class will be able to apply it in a clinical real-world setting, so it just really all correlates together. When we're not in class, we have what's called independent learning time, where we can go on our own to review different materials, go over lecture notes, study with our friends. So if students like to learn on their own, do more independent things, the library is a really good place to go because there's books on reserves that you can check out, so you don't have to buy your own books or anything like that. For me personally, I like to do things that are very active, hands-on. So I'm known as a girl that carries whiteboard markers in her backpack because I like to draw out flowcharts and diagrams and just kind of visualize everything. And I like to talk it through with my classmates and kind of like teaching each other, so really enforce the material. We have the DDM, which is the Med Student Lounge, where you can go talk to other students. There's like whiteboard space available to draw out diagrams and pictures. Or if you like to do things more hands-on, you have 24-hour access to the histology and anatomy lab. So it's great to have all those resources at your disposal. What I feel like they've done is really provided students with a plethora of resources, and you can pick and choose what resources you want to use that would help you learn the best. For example, we have the Visible Heart Lab. During our anatomy class, we actually got to take a little break and go down, check out some of the research they're doing in the lab, get to see some hearts, and kind of see the bigger picture with what we're learning in class and the clinical correlates. Also, there's like the Sim Portal, where you get to do hands-on things, working with equipment, practicing, doing suturing, different surgery techniques. One of the opportunities we've had is working in the IERC, which simulates patient clinic rooms where we can go in and do practice physical exams on each other and standardize patients. So I think with the new curriculum, where we're given free rein to learn in any way we want, it really helps keep us going because we're doing things that we're enjoying. So everyone's really excited to learn, everyone wants to talk about medicine, everyone wants to find activities that relate to medicine, so there's just this big energetic vibe amongst the med students.